I think from learning from working with the Boys and Girls Clubs in New Jersey, and then went to Florida and started to work with different organizations down there. I brought some of that knowledge here, which is the one thing is you're not a savior to everybody. You're not going to be able to save everybody, and I've learned that early in a few times. You try to help who you can help, and then you work hard and continue the good work. Some of the struggles that I've had, with dealing with this is sometimes you bring a lot of the work home, and then you can, you're deciphering how did you let one kid get away and you save this other child. So I think the best thing for me, if I was talking to anybody and letting them know the struggles and how, as a pillar in the community, I can continually help them and help myself, is to find different resources, knowing that you can't do everything yourself. You look for other people who may be quote unquote experts, or people who have those specific skills that you might not have. With my new role and my current role that I've been doing for a while, it's almost like one-stop shopping. So it's like you almost have to get abreast of all the resources you have. So, it could be from public health, it can be from, crisis management, it can be from, just finding a person who's from their religion, or even finding a person that they might associate with that's from their country, so that bridges the language barrier, or somebody just to teach you from time to time on the struggles, and an example would be, somebody told me he came from Somalia and he wasn't afraid of guns because he heard shooting every day. And when you see those type of things and then understand that the respect for, guns is not a big thing to them because they've been holding a machine gun from 7, 8, 9, 10 years old. So when you start to delve into the different characteristics of each child you're dealing with, then you find out how you can help them. I've worked with many organizations that have helped children, youth, and adults. Doorsteps Neighborhood Services has been a big one in my career. Hope House Charities has been a big one in my career. So, in dealing with just those two for now, they've helped not just, one nationality, one race, one age group. They've helped it across lines. They've always had given us the opportunity to have input, which is why I'm naming those two. I've worked with other ones, throughout the time that have been, a year or two, and they've had specific initiatives. But these two have, wanting to be broad-based, helping youth, helping families, not just on one level, but in many levels, which would be like the holistic aspect, the eating aspect, the physical interaction, the mental levels, the schooling. So I like to work with organizations that are not just specific based. I want them, we need to help these kids